Sarah. I'll be your nurse practitioner student today doing your physical exam. How are you doing?
I'm good. How are you?
Good. Patient appears alert and healthy, no signs of anxiety or distress. All right, I'm going to check your hands first. Skin turgor is good. Skin is soft, warm, dry, clean, and intact. Nail beds are pink. Capillary refill is brisk. No clubbing noted to fingers. Arms are symmetrical. No deformities or masses noted. Check your radial pulses. Radial pulses are equal, +2 bilaterally. Brachial pulses. Brachial pulses are +2 and equal bilaterally. All right, let's do some range of motion. Remember, you hold your hands open like this and close, open. I want you to touch each finger to your thumb. And now do it quickly. Good. Now I want you to flex and extend your wrist and side to side. Good. And then flex and extend your arms. Good. Now I want you to bring arms down and up. Very good. And arms out to the side. And then behind your head. And then back down and behind your back. Very good. Now bring your hands up again. I want you to hold your hands like this and push against my hand. Good. And then push. I want you to hold your arms like this. And don't let me pull you. And don't let me push. And then arms out to the side. And don't let me push you down. Good. And then lower your arms. And I want you to shrug your shoulders against my hands. Good. Cranial nerve 11 intact. All right. Now we're going to check your reflexes. And have you just lay your arms comfortably at your legs. Your brachioradial reflex, intact bilaterally. Your bicep reflex, intact bilaterally. Tricep reflex, intact bilaterally. Patellar, intact bilaterally. Achilles, intact bilaterally, and Babinski. And negative Babinski reflex. All right, now moving to your head. Face is symmetrical, skin is intact. Cranium is also symmetrical, no nodules or depressions noted. Hair is soft, evenly distributed. Scalp appears to be free of any dryness. Now moving to your face. Again, face is symmetrical, skin is clean, dry, and intact. I'm going to have you frown and puff your cheeks. Cranial nerve 7 intact. I'm going to touch your face in 3 spots on each side. I want you to tell me if you can feel it, okay?
Yes. 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 Yes.
And cranial nerve 5 is intact. I'm going to listen to your temporal artery. No bruise noted to temporal artery. I'm going to feel your sinuses. Any pain here?
No.
Here?
No.
So no pain or tenderness to the frontal or maxillary sinuses. All right, now let's do your eyes. First we're going to check some things with your vision, okay? I'm going to have you look right at the end of my pen and follow it with just your eyes. Don't move your head. Follow it into your nose. Good. So cranial nerve 3, 4, and 6 intact, and accommodation and convergence also intact. I want you to touch your nose and then touch my finger. And now the other hand. Corneal reflex is symmetrical. Again, kind of look at the wall behind me. Pupils are equal and round and reactive to light, both direct and consensual reaction or response noted. I'm going to feel your eyes. Any pain up here?
No.
And open. Sclera to both eyes is white. Conjunctiva are pink. Cornea is smooth and glossy to both eyes. Irises are equal bilaterally. And this light is bright. I'm going to dim the lights in here. And then look just at that wall behind me. So red reflex noted to both eyes. Retina, optic disc, and vessels noted. And again, retina, optic disc, and vessels noted. All right, look at your ears. Skin is clean, dry, and intact. No nodules noted. Any pain? No pain to the ears or to the mastoid process. No drainage noted. So, tympanic membrane visualized. It's pearly gray. Light reflex noted. No erythema or drainage to the ear. Again, tympanic membrane visualized, pearly gray, light reflex noted, no erythema or drainage to the ears. All right, so I'm going to check your hearing. I'm going to do a series of 3 letters or numbers, whisper, and I'm going to have you repeat after me. Can you cover your left ear with your left hand?
T46.
On the other side, I'm going to have you plug your right ear.
695.
Very good. Now at this point, I'd be doing the Weber test with a tuning fork, which I don't have, but I'd cause a vibration in the tuning fork, place it on the patient's head, and ask, can you hear the sound better on right or left or equal?
Cool.
And equal would be the expected response. All right, now I'll move to the nose. Just going to palpate. Septum appears to be intact. I'm going to have you plug your nostril on one side and breathe in and out. And then the other side. Good. Cranial nerve 1 intact. Upper and lower turbinates visualized. Nasal mucosa is pink and no drainage noted. Mouth. All right, so lips are pink and moist. Can I have you open your mouth really big? Buccal mucosa is pink. Teeth are well seated. Can you stick your tongue out and say ah?
Ah.
Uvula is midline. Upper hard palate is white and soft palate is pink. And stick your tongue out again and then side to side. Very good. I'm going to have you push your tongue against the inside of your cheek on this side. And then on this side. And then open big again. No crepitus noted to TMJ. Okay, now we'll move to your neck. Neck is symmetrical. skin is soft, clean, dry, and intact. Trachea is midline. Can you swallow for me? Good. And thyroid rises midline with swallow. And feel your carotid pulse. And auscultate. Carotid pulses are equal bilaterally, no thrills noted. I'm going to check your lymph nodes. Pre-auricular, any pain here? Posterior auricular, any pain here? Occipital, any pain? Tonsillar, any pain? Submandibular, submental, superficial cervical, deep cervical, posterior cervical, supraclavicular, and axillary. No nodes palpable, non-tender. I'm going to wash my hands. Okay, I'm going to check your range of motion on your neck. Can you bend your chin down to your chest, and then back, and then ear to your shoulder, and then the other side, and then turn, and turn. Good. And I'm going to have you turn against my hand this way, and then this way. Very good. All right, now we're moving to your back. If you could turn just slightly this way. All right. You're fine. All right, visualizing the back, spine and rib cage appear symmetrical. Skin is clean, dry, and intact. No masses noted. No heaves, no use of accessory muscles, no dyspnea noted. All right, can you take a deep breath in and out? Good, and symmetrical expansion of chest. And I'm going to palpate. Resonant percussive sounds noted. Any tenderness here? Any tenderness there? Negative for CVA tenderness. Auscultate. Whenever you feel my stethoscope on your back, I want you to take a deep breath in and out through your mouth, okay? Vesicular breath sounds noted throughout, no adventitious sounds noted. Now move to your front. Again, inspecting the chest. Rib cage appears symmetrical. No observable dyspnea, retractions, or use of accessory muscles. And again, no masses or nodules noted on palpation. Respirations appear even and unlabored. Deep breath in and out. So vesicular sounds heard throughout. Now I'm going to have you lie your head down here. Alright, so I'm observing the precordium, not noting any pulsations, and then feeling the precordium. Again, no pulsations or thrills noted. I'm going to locate the PMI, the fifth intercostal mid-clavicular line left of the sternal border, and palpate. I'm going to auscultate. The pulse at the PMI is 70, no extra beats or murmurs noted. And I'm going to auscultate at the aortic area, second intercostal right of the sternal border, the pulmonic area, second intercostal left of the sternal border, Erb's point, third intercostal left of the sternal border, tricuspid, fifth intercostal space left of the sternal border, and mitral, fifth intercostal mid-clavicular left of the sternum, so no murmurs or extra sounds noted. And I'm going to repeat with my bell, aortic area, pulmonic, Erb's, tricuspid, and mitral. And again, no murmurs or extra sounds noted. All right, so I'm going to lift your shirt up just a bit and observe the abdomen. Contour is symmetrical, abdomen is flat. Now, can I have you raise your head just a little bit? Very good. So no signs of hernia, no grimacing to patient's face. And I'm going to auscultate. So active bowel sounds in all four quadrants. I'm also going to auscultate the vascular sounds at this point. The aortic area, the renal, and iliac, and no bruits noted. I'm going to percuss. Tympanic resonant sounds throughout abdomen. And then light palpation. Let me know if any area I'm touching feels tender or sore. All right, no masses noted, no tenderness on light palpation. Now I'm going to do it a bit deeper. Nothing tender. Again, no masses felt and no tenderness. I'm going to palpate for the liver border. So liver border palpated, no nodules, no hepatomegaly. And the spleen. The splenic border, non-palpable, no splenomegaly noted. Okay, I'm moving down. the legs. Legs appear symmetrical, both in length and size. No edema noted, no pretibial edema. I'm going to locate the femoral pulse and auscultate. Femoral pulses are equal, +2 bilaterally. I'm feeling for the inguinal nodes. Any tenderness? So inguinal nodes are non-palpable and non-tender. I'm checking the toes. Nail beds are pink. Capillary refill is brisk. And pulses, posterior tibial pulses. Equal, +2 bilaterally. And pedal pulses. Equal and +2 bilaterally. Can you push your toes against my hand? Very good. Now I'm going to have you rotate your feet out to the side like this and in towards each other. Very good. And then move this leg out to your right and back in. And then move your left leg out to your left and back in. Good range of motion. Now I'm going to have you bend your knee up towards your chest and then straight out. Good. And now other leg in towards your chest and straight out. Very good. And then flex your feet and point your toes in and toes out. Very good. Good range of motion to legs and feet. I'm going to check your strength. I'm going to have you bend both knees for me towards your chest. And I want you to push down with your ankle. Very good. And then push up against me. And then push back with your thigh this way. Good. And then let's repeat with your other leg. Push down your foot. And push up against me. Push back towards me. Very good. Good range of motion. Now I'm going to have you slide this heel down your right shin. And then repeat with this leg. Excellent. All right, now I'm going to have you sit up slowly. And then turn your legs to the side. So give yourself a minute so you don't feel dizzy. Whenever you're ready, you can stand. Alright, so I'm going to have you walk towards the wall. Just walk normally. Gait is symmetrical. Now walk towards me heel to toe. Very good. And then turn towards the wall. Walk on your tiptoes. Now on the heels of your feet. Very good. Gait is balanced as well. Now I'm going to have you close your eyes. Checking Romberg sign, and it's negative. Very good. All right, can you turn and face that wall again? I'm checking your spine. Spine appears symmetrical. Shoulders, so scapula are even. Iliac crests and gluteal folds are all even. Now bend down and reach your toes. Very good. Scapula even. Iliac crests and gluteal folds even. And stand back up. No excess curvatures to cervical, thoracic, or lumbar areas. And AP lateral ratio is 1:2. All right, so now I'm going to have you bend back like this and bend forward. Very good. And then lean towards your side, lean towards your other side, and then rotate. Excellent. Good range of motion with spine. All right, I think we're done for today. Thank you so much.
Thank you.